Hi, Mama Bestie. It's Francisco with Shaw Dula here. Today, we're going to talk about gestational diabetes. We all know what that is, or we should know if we're pregnant or if we've had babies. But remember that nasty flat soda drink that you took, the glucose test you took when you were pregnant? That's what we're talking about today. So, gestational diabetes is it's an illness that occurs during pregnancy. It usually shows up between 24 to 28 weeks, but you know how that goes. Things can happen earlier or it can develop later. So we want to really keep a diligent watch over our bodies and how we're feeling when we're pregnant. 1 in 10 women will develop gestational diabetes. So if you have 10 pregnant friends, one of y'all will get it. So it's that common. It's that. Obviously, its increased rates are with women of color. So Black and brown women, indigenous women, we have it in higher numbers. And then if you are advanced maternal age, you have a higher risk at developing gestational diabetes as well. Gestational diabetes doesn't feel like anything, or really shouldn't. There are some things that you can look for. Obviously, increased thirst. Like that's like a diabetes thing. If you have super always thirsty, if you're urinating a lot, that's something to think about. And that's tricky because in pregnancy, you're already urinating a lot. So you have to kind of keep watch of that. If you're swelling, so if you have like edema and you push your skin and there's like indents in your skin, so you're retaining a lot of water, that could be a sign as well. But you do take your test around the 24-week mark. It may be a little bit earlier now. And that will identify if you do have it. Your doctor usually gives you a couple tests. The one that we all remember is that glucose test with that nasty flat soda drink. But there's other tests that they give you along, while you're going along your pregnancy. If it's not treated, it can really cause some really bad stuff to your life. Like it can make your baby super, super big. So women who have gestational diabetes, this is not all the time, but this is a common thing you see with women with gestational diabetes, is their babies will be really big, over 10 pounds, 13, 14 pounds sometimes. And that will cause you not to have a vaginal delivery. In those situations, you might have to get a cesarean section. If you do get diagnosed with gestational diabetes, sometimes your doctors will try to induce you so you don't get to 40 weeks, so you can have the baby at a healthier time, so it's not so big.